Good morning. This is Dr. McDaniel at GYN Corner. I'm a gynecologist here in Midtown Manhattan, and I'm presenting all things health related for women. Please check out the YouTube channel. It's also called GYN Corner. And like, subscribe, comment. Please post questions and ideas for topics that you'd be interested in hearing. Thank you for joining me. And as the presentation title indicates, I thought I'd speak on can we test for PCOS? So yesterday I spoke about PCOS, or polycystic ovarian syndrome, and I get probably 4 to 5 women a week who come in saying that they think they have polycystic ovarian syndrome, or their dermatologist told them to come in and see the gynecologist because they think they have polycystic ovarian syndrome. So it comes up quite frequently, and sometimes the women are incorrect, sometimes they're correct. But polycystic ovarian syndrome is predominantly a diagnosis of signs and symptoms. So as I spoke about yesterday, it's basically a trifecta. It's basically a diagnosis tripod of irregular cycles because the lady's not ovulating regularly, so it's anovulation, and it's a syndrome of increased male pattern hair manifestations. So that's hair growth, facial, chest, back, stomach, and hair loss, baldness, male pattern baldness. And it's also a diagnosis of signs or symptoms of insulin resistance. So central obesity, pre-diabetic, and diabetes, what we used to call adult onset diabetes or non-insulin dependent diabetes. So those are the 3 primary necessary aspects that one has to have to diagnose this lady as having polycystic ovarian syndrome. And then when women come in for testing, predominantly it's going to be evaluation on a physical exam, and then after that it's going to be blood test. Blood tests are hormone panels. So first we draw their hormones to confirm that the irregular cycles are not due to other medical conditions. So the other conditions can cause anovulation or anovulatory cycles. That's going to be pituitary, brain hormone called prolactin, thyroid hormone, ovarian hormones, 3 ovarian hormones, LH, FSH, and E2, so luteinizing hormone, follicle stimulating hormone, and estradiol. And then we also check to see if there is increased levels of free testosterone. So I always order total testosterone and free testosterone. Only the free testosterone has an effect symptom and sign-wise. The total testosterone is just what their body's producing, but it may not be what's actually causing issues for them. So the free testosterone is important. 17-hydroxyandrostenedione is another test that's done. It's to look for congenital adrenal hyperplasia of late onset. So it's a metabolic disorder that basically masculinizes or virilizes babies, but if it's a late onset, then it's women. I also check for another test called sex hormone binding globulin, and that's really to see if there is a high level of that protein or a low level. If it's very low, then they'll have increased androgen symptoms or masculinizing symptoms. And let's see, for part of the physical exam, it's also history. So the main thing is to ask women if they've been taking any kind of medication, supplements, or herbs that could potentially interfere with their menstrual cycle, because some of the over-the-counter herbs are plant hormones and they can interfere with the menstrual cycle, cause skipped cycles or irregular cycles for some women. So those are all of the blood tests. And then an ultrasound or a sonogram is obtained primarily to confirm that this lady does not have an abnormal buildup of blood or tissue in the uterus due to the irregular skipped cycles. And for some women, it will be irregular skip cycles, and then occasionally crazy cycles where they're bleeding for 2, 3, 4, even 6 weeks or more. So for them, it's to see if there's abnormal tissue buildup, but also to see if there are abnormal masses or growths or polyps tissue that's causing the extra bleeding. And then on the ultrasound or the sonogram, we also look to see if this lady has ovarian manifestation of irregular anovulatory cycles, so what we call polycystic ovarian changes. And as I mentioned yesterday, the cysts are always very small, 5 to 9 millimeters. They're physical representations of anovulatory cycles because the eggs or the follicles start to mature, to develop, and then they arrest in development, so this lady does not ovulate. And the general definition with the radiologist is that they'll see approximately 12 follicles or more in a ring or circular circumferential pattern on one or both ovaries. Now, as I also stated yesterday, you can have polycystic ovaries without the syndrome, and you can have the syndrome without polycystic ovaries. So it's not a very stable or consistent manifestation of PCOS. So I hope that's been helpful in describing the testing that we do and the evaluation that we do to diagnose polycystic ovarian syndrome or polycystic ovarian disease. It's not just one test, it's multiple tests, and the most important is the physical manifestation. Oh, I'm sorry, I forgot. Also, I forgot it. It's the insulin resistance part. So we will should always do a fasting glucose level to screen. It's a general screen for diabetes, and then a hemoglobin A1C if that level is increased, along with a fasting insulin level. Those are the three things we always check to see if there's evidence of insulin resistance. So forgot to add that part. I don't know how it just popped into my mind all of a sudden. So this is Dr. McDaniel. I'm a gynecologist, obstetrician gynecologist here in New York City, Midtown Manhattan. If you're in the tri-state area, come on by. We have appointments Monday through Friday, and we see walk-ins every day. Just call in the morning for the walk-in hours. We're in Midtown Manhattan, so we're around the corner from Penn Station and Macy's. We're a few blocks west of the Empire State Building. And check out the YouTube channel, please. I have all of the presentations, the talks nicely delineated there. We're all things health related for women, so if you have questions or suggestions for topics, please post them either here or on the YouTube channel. I'll be happy to answer them, be it pregnancy, menopause, or anywhere in between. Also, juvenile children, young girl questions or concerns for young girls is fine. Thank you very much. Have a great rest of your Wednesday, and I'll be back tomorrow, Thursday, almost TGIF. Bye.